Welcome to the Dental Handoff. I'm Dr. Kelly Tanner. Today, I have a hygienist with me, Kendra, welcome, who has a very unique path in dental hygiene, and I cannot wait for her to share her story. Kendra, thank you so much for being on today.
Yes, thank you for having me. I'm excited.
I know. So we always start with the question, why dental hygiene? Why dentistry? Did it choose you? Did you choose it? What happened?
Yeah, it chose me. I wanted to be a music teacher. That was where I started. And then I, grew up not the most privileged lifestyle, and I was working at Taco Bell, and I didn't want to do that forever. So I looked up quick careers. And my mom always told me to go into healthcare. So I knew I wouldn't want to be a nurse. I couldn't do any of that. And so I found dental. And I said, well, let's try. So I went to dental assisting school, loved it. And then I said, okay, let's look at dental hygiene. Again, loved it. So it chose me for sure. Yeah.
Awesome. What was the favorite part? Like once you went, so dental assisting school is a different experience, obviously, than dental
Yeah.
hygiene school. Did you know that when you're a dental assistant, you're like, this is it?
Yeah, I think doing that course, it was a 9-month program.
Mm.
So not necessarily, weekends or shorter time, but just getting out and hands-on learning about the body, even though it's at a higher level than hygiene, and learning how everything interacts. I was just so excited about that. And then also being able to make a difference, hearing some of the graduates out in the field and what they got to do with their lives.
Yeah, it's we can touch, and you're going to talk about how you touch lives too. So you went out and did you practice as a hygienist for a while? Tell us what happened after you graduated.
Yeah, so it again, non-traditional path. So went to dental assisting school, practiced in a pedo, high Medicaid practice, and then moved into a private practice pedo office. Did that for about 6 years while I got all my prerequisites for dental hygiene, and then went to dental hygiene. I graduated in 2010. So we had people the year before us graduate that still hadn't had jobs. I actually worked with went to school with a few ladies who never went into hygiene. They couldn't find a job.
Mm. That was
So,
right after the market crash for those of you all who,
oh yes,
yeah, for context, because I had another whole business where I was doing something else, but the economy was crazy. You had dentists selling,
oh
there were
yeah,
dentists selling their practices to go work as hygienists for other dentists.
yeah. And that was what was happening is they weren't hiring hygienists because they were having such a hard time staying afloat.
Mhm.
And so it was like I just went to school for 4 years, and now I can't find a job. And we were always told corporate is evil, right? And so
Mhm.
I tried my hardest to stay away from the corporate world um, because of that message that I received throughout my career. And unfortunately, at the time, that was the only place that would hire me. It would be 100 people would apply within 20 minutes of a job opening. Like you would just sit and just try to apply, and hopefully they would take you. And but I started off with Pacific Dental, and that was eye-opening to see that there was a level of quality and there was a high standard, and sometimes more so than in private practice. Especially when I started to temp and realized what exists. And so that's where I was sold on the value of a DSO.
Yeah, the saying goes, one DSO and one DSO. They are all so different,
Mhm.
and I highly encourage you all, if it's so hard to generalize anything just with one statement, to say, oh, they're all bad, they're all this way.
Yeah,
They are all so different.
so
And so
different.
if you've never taken a look at a DSO, it's not the same. One is not the same as the other.
Yeah, for sure. And I was able to work for Heartland as well when I moved across the country. And that was to me completely different than Pacific, and not worse or better, just different.
Yeah.
And so, I think now in 2024, there are enough DSOs that you can find a fit that will work for you. One thing I will say is no matter where you work, DSO or private practice, public health, their mission, their vision has to align with your own values. Because if it
Yes.
doesn't, you will be miserable. You won't want to work. You'll just be fighting against your 8 hours that you're putting in there.
Yeah.
So that's my biggest piece of advice for that.
Yeah. It's, and I think that that's true anywhere in your life. You have to stand up for what you're
Yeah.
about.
Mm-hmm.
Right. And in a respectful way, and just say,
Yeah.
you know, this is who I am. This is my value system. This is, you know, and here's why. And here's why. Here's what I've learned. Because sometimes people don't know because they've always done it that
Mm-hmm.
way too.
Yeah.
So thank you for bringing that up. So Kendra, you went on to work with DSOs. Where are you at now? Like, where has your path taken you?
Yeah, so it's a long explanation. I tried education for a while, teaching dental hygiene. I learned that was not one of my passions,
Mm,
and it's great for others, not for me. Uh, and then I moved into a clinical operations development role for a large DSO. That was what I felt was my dream job. So it brought in compliance, brought in quality, brought in clinical education all in one
mm.
role. And then COVID happened. So as we know, yeah, surprise, decimated dental. We know that. I was able to quickly pivot into Walmart Health, which was what I consider a non-traditional DSO.
Mm, yeah.
And so integrated, if anyone knows PDS Health, that's something similar they were trying to do. So we had primary care, optometry, dental, behavioral health, labs, x-rays, all in one roof.
Mm,
And so when I heard what the mission was at the time was to serve the underserved and meet them where they were at, I was sold. And so I left and went there. And unfortunately, that journey ended. But I was able to find a new position with Smile America Partners. And
mm,
so it's a mobile, portable dental company. And so we serve children, and usually low income children, in the school setting. So they're all over the country. They've been around for 27 years. The founders are still active. And it's exciting because what we see is most of these children, they don't have a dental home. We are their dental home.
mm.
Even though we're portable, we are able to come back to the schools multiple times. We refer patients out for treatment. They sometimes, and a lot of the times, never get it done. We are their dentist. I've even heard stories where we give them the one toothbrush they have a year. So these are the types of things that my heart loves, that drives me, and this is why I knew right away that this company is in line with my mission and my values, absolutely. And I'm so proud that one of their the elementary school that I went to, they actually serve. I would have been one of those kids. And so,
Oh, wow.
yeah, it was full circle for me. But I think there too is that there's a bad rap, right, with DSOs, but also mobile dental,
Mm,
same thing. And to know that, I am able to make a difference. We're able to make sure that the quality is there, that all the kids are being treated in a great and productive manner, that they don't grow up scared, because the same thing, we're their home. So just like a pediatric dentist, you want to make sure that they're having a good experience.
yeah. Wow. When you said that you would have been one of the children in that elementary school, I bet that just struck your heart chords. And you are exactly right in that. I remember when mobile health or telehealth came to Virginia, or the idea that came to
Hmm.
Virginia, probably about 15 years ago or something around that. And the local area dentists were up in arms because they felt like
Hmm.
it was cherry picking. And cherry picking,
Yeah.
meaning, coming in to take the money to then leave, and never really for the patient to not have access to a dental home. And I mean, that could be true of anything, right? A
Hmm.
plumber, a painter, they come
Yeah.
in and
Yeah.
and they just take what they want and leave. But the end mission of this is to truly serve. And who else is going to serve and step up? Because I think that these privatized, like you and I were talking about back in the green room, the privatized mobile telehealth companies, or however you're terming it, they can get a bad rap because they're
Hmm.
going in and caring, and they're not a dental home. But as compared to what? What other kind of
As
access do
compared to nothing. To me, right, that's a dental home. So yeah, and I was calling it privatized public health.
public health? Yeah.
So yeah, so I think that's the piece where I hear this a lot. I've heard it before. I was pretty active in our state association um, for dental hygiene, and you'd hear the same thing. Well, they're gonna steal my patients. These patients aren't being seen. They're so we're not stealing anybody. We're serving who we need to serve.
Yeah, they're slipping
And
through the
so
cracks. They're
yeah,
the people who slip through the cracks.
or they can't get there, or you may be in the a foster system. You may have parents who unfortunately just don't care. I mean, that we just, not that everyone is that way, but there are circumstances that way. They don't
It's not
care.
a priority. It's
Yeah.
not a priority.
And so it's great that they can just sign a permission slip and we can see them and they don't have to worry. We can remove those barriers to access. But we do experience the same issue of them even being able to find a dentist that accepts Medicaid if they can get there, if they can take off a whole day of work, depending on who it is, whether it's the grandparent or the parent or guardian. And I think that's the piece that is frustrating for me, is that if everyone remembers why they started in dental, it was to make a difference in the patient's lives. It, it happens to provide a good, comfortable living in life, but ultimately have to do our part. We have to provide our ethical, I can't think of the word. I know I was
Duty. Yeah,
duty. Yeah,
duty.
ethical duty. We
Yeah.
have to provide that. And so when you look at some of these statistics where certain states, they aren't accepting Medicaid, in some states, it's in single digits, right? And so if there is no area for them to go to, even if they could get there, what do we do? And I understand that their reimbursement level is not where it would be as a cash or commercial insurance. But if we serve our whole population, then everyone does better. And so that's where it's almost of a call to action to me, is I see a lot of these, and I understand, I know the business side, but I see these, get away from commercial insurance, go fee for service, cap. That's great, but we are leaving a lot of people behind, a lot of people, and a lot of children, unfortunately.
Mhm. And we know that early childhood caries is an indicator for caries and other dental diseases later on the road, down the road. So we know those statistics.
Yeah, yeah. And me, even as a dental assistant, I would be in the hospitals with 2-year-olds, and I have seen them remove every single tooth out of a 2-year-old's mouth. So, and that was in private. That wasn't necessarily in the Medicaid office. So I think those are the things that we need to focus on: prevention, which is also very difficult for dentists. They're trained to drill. It's hard to go that way. I always say, right, hygienists, we're trained in preventative health. That's the whole reason why we
Mhm.
exist, just like nurses. And then you have the dentists who are like surgeons that are trained to
They
treat.
treat. Yeah, they treat.
Yeah. So how do we merge and make that work? And I think this is where we're at in a dental industry right now, is they realize, everyone realizes that, we have a lot of technologies coming out that can truly treat caries,
Yeah.
stop caries,
Yes.
and move us into, I think, what people probably hoped to have 100 years ago. Oh, I wish I could just place this and it would be fixed.
Yeah.
We're there, and so I think the next step only is to regenerate, right, a tooth, which I hear we're close to too.
Yeah. Yeah.
But I think this is the point where my boss, Dr. Scott Kalnes, he always says, "You do well by doing good.
Mm.
You will be fine. There is enough treatment in the world right now in the United States that honestly, our company and if you've worked with patients, you know that not everyone is getting the treatment they need to get. It's
No,
out there. If we just do and make the recommendations that is there, we don't even have to worry about money. Um,
I agree.
so that's our
Scarcity
model.
mindset. Scarcity mindset just kills me.
Yeah.
It's we and and us and these safety nets, because that's
Hmm.
kind of what you are. You're a safety net, public
Yeah.
health, privatized, you know, a
Yeah.
type of business, DSO, and you're going to where the need is. You're literally meeting the children where they are. And for our listeners who are not as well versed in what does it mean with Medicaid reimbursement.
Oh,
Well, over the years too, it's that if a procedure costs $50, Medicaid could reimburse the doctor maybe what, Kendra?
a third,
A
maybe.
third of
Yeah.
that. And so how do you
Yeah.
stay in business? How do you keep the doors open? So it makes it very difficult for Medicaid providers to stay open. So what ends up happening, Kendra, too, and you can speak to this, is that in a brick and mortar setting for those dentists who do accept Medicaid, they have a lot of no-shows because of potential barriers that
Hmm.
are there, because the same things that keep people from getting treatment are the same things that are going to keep them from coming. And so they experience those barriers, and they don't show whatever. Maybe it's fear, maybe it's getting off work, maybe they're taking
Hmm.
care of someone sick. I don't know, transportation.
Yeah.
But what happens with these offices that do actually accept that reimbursement is that they'll overbook them
Hmm.
because so many of them don't show. So with you all, Kendra, with your model, do you all see that because you're going to the schools, right?
Yeah. The biggest barrier is permission.
Hmm.
So as long as they right provide permission, then and they're present, I should say that, and they're present, then we can see them on that day. But I think that just opens it up to our systemic issues with healthcare, but also dental care. And it's not just one problem, right? We could maybe, and you said this, depending on what the issue is, we could have 100% of people somehow right into law that you have to take Medicaid. But that doesn't solve how do they get there? How
Hmm.
do they afford taking the time off? Dental intelligence, they might just not know. They have no idea that this is important. As we know in pediatrics, oh, you let them wait till their teeth fall out. Well, no, no, please
Yeah.
don't wait. And yeah, and they can die. We think about that, Demonte Driver. All of those things are just, it's multifactorial. And so it's not going to be a quick solve, right? It's going to take all of us working together, and not just dental. Healthcare as well. And so you mentioned that is that, we're able to serve them, and we we know that there's data out there that children are more likely to see their dentist than their medical provider. So, we have the opportunity to also screen for that. Now, luckily, right, they have school nurses at these schools, but we still can try to identify other issues, neglect, abuse, those types of things that we get to be really the advocate for the child, not just their mouth, but their entire being.
Yeah. Yeah. What a amazing service that you all
Yeah.
provide. Thank you for doing that, Kendra.
Yeah.
And so
Yeah.
with your role, so tell us a little about, we're going to shift just a
Yeah.
little into what does your day-to-day look like? What is your role? How do you support the organization and the clinicians?
Yeah, so I would say my role is I'm new into this role, so still learning about more about the company, about their processes and things like that. But it's really helping with our senior dental advisor, which is Dr. Kalnes, and the rest of the senior leadership team is a strategy around where our clinicians are are going, what we're doing, clinical philosophies. So we work on education and training, clinical compliance, quality, all of those things. We pull that together, and we call our team the clinical excellence team. But really, that's what we're looking at. So how do we become more efficient so we can provide more treatment to these children? If we know we're leaving them behind, we know we have the same barriers that other DSOs have, right? Hygiene, dental shortages, staffing issues, all of those things, inflation, procurement, all of the things we have too. So how can we do better so we can see more children and provide all those great services that we mentioned? And so it's fun. It's a challenge, but it's fun. And so you're really, when I say non-traditional, anything that you're doing that you might do day to day in your clinic, you got to pivot and think, how does this work in this setting? Well, it might not. So, okay, well, what do we do? How do we solve for this issue? Or how do we become more efficient at whatever we do? So just think about this. We don't really see the parents. So you don't get to have oral hygiene instructions with
Right.
the parent, right? And so thinking about how to optimize those types of things. So it's a challenge, but for me, it's a fun challenge. I like to solve problems and I like things to be difficult. So
Well, because you see the opportunity in it.
yes. Yeah.
And that's where you shine,
Yeah.
probably, is seeing the opportunities. Where are you guys located? Which areas do you serve currently?
So we're over 19 states all over the country,
Wow.
and rural areas, West Virginia, super metro areas like LA County, Chicago, New York City is a big market of ours. So we kind of do a little everything. And so then you have that on top of it is, well, what does that mean for a rural area compared to an urban area? Even our own internal differences is slightly different. But it really is great to be able to create a clinical culture is really one of my big focuses this year, really around the mission of the company and reminding us all why we do what we do and that we're making a difference and we can measure it. And so I think that is great. Where again, I worked in traditional dental settings, and you treat one patient at a time. I got a little bored because I like a challenge, and so this is a great reminder is that even though you as a provider may only get you might only see a certain amount of patients, but as a whole, as a company, you're making a huge difference and a big impact.
Oh, yeah. And for the rest of their life. For the
Yes.
rest of their life. So what is
Yeah.
one of the biggest barriers that you feel like, so why are you not in every single state, for
Mm,
instance? Is it
yeah.
workforce? Is it a permission? What's the biggest barrier that you face, you think?
I would say legislative issues.
Mm.
So as I think DSOs experience, certain dental boards, certain associations are not fans of this. And I think that goes back what you said, the scarcity issue, or thinking that DSOs or mobile, whatever you're talking about, maybe the quality isn't there. And so that's where you'll struggle. And you just want to bang your head against the wall. Say, I'm trying to provide your public
Yes.
good. And you are literally, your hands are tied. You can't.
Yeah, because they
Pro
can't see here. They're
Yeah,
very myopic and their
yeah,
vantage point.
yeah, and I think it's also this same healthcare head detached from the body that, okay, if you are dental, you only focus here, and then healthcare focuses everywhere else. I think the same thought is, well, public health is the one that serves that. Okay, well, public health might only be able to serve 10% of that population.
Yeah.
So we have to all work together to be able, and even then working together, we're still leaving people behind, but we have to work together to be able to touch these populations. And so I think that's the biggest piece, is running into laws that just do not allow us to do that. And I've seen that not just in this setting, but even I'm in Georgia. And so for a while, forever, general supervision for hygienists was just not allowed. We just got local anesthesia 2 years ago. Laser we're making headway. By the way, Misty Mattingly, amazing.
Yes,
If you
she
haven't met
is.
her,
I love Miss.
yeah.
Yeah.
So those are the things that, no matter what it is, it's a barrier to access, or quality access, which is one of the concerns, by not allowing providers and clinicians to do what they're trained to do.
Yeah, it's baffling to me why that's allowed. It seems like there are just so many penalties, or we're penalizing the public by not allowing this care to occur. And it's not about me trying to take anyone's job. It's not about me trying to get rich off of this. It's not, it could be regulated in a way to sign agreements where that's not allowed to come in and cherry pick. There's other things that could be put in place, but when I feel like it's so short-sighted, that keeps everything oppressed. That is just hard. That is just hard to watch and hard to stomach.
Yeah. And the data is there. So you'll see in the states that are most restrictive, and across healthcare, not just dentistry, their health outcomes of their populations are lower. Georgia is one of those.
Of course.
We know this. Yeah.
Of course it is.
So it's not, again, you're not going to get rich off treating this population. It's just not going to happen. You have to do it because you want to do it.
Yeah.
And so I think that was well said. But we need to be able to allow those that want to, that need to treat those people. We need to allow that.
Yeah. Remove those barriers. So Kendra, thank you so much for what you're doing. Are there any final thoughts that you'd like to offer to our audience?
Yeah. I have said this a lot in the last few months. Just ask. The worst thing anyone will tell you is no. So if you are thinking, and this is me thinking through the non-traditional solutions of wherever and whatever I'm doing, bring it up. Ask your legislators. Sometimes I think when we were doing campaigns, it only takes 10 people reaching out to change their minds on certain bills or things that are happening. Just reach out. A conversation is not going to hurt. It doesn't really cost anything, especially now with Zoom and cell phones.
Right.
You don't have to go down to the Capitol and get involved. Whatever your passion is, it doesn't have to be children. It doesn't have to be low income. There's geriatrics. There's special needs. The world is your oyster, but really, I think people lead with your heart, and you'll be able to make a difference there. And so whatever that is, I'm willing. I think Kelly will give you guys my information, but whatever you need, I am willing to help or figure out figure out who I can get you in contact with to start that journey.
Kendra, thank you so much for your heart on this. And if you guys want to reach out to Kendra, as you know, her information's in the show notes. I mean, just phenomenal work that you're doing and your organization's doing. Thank you from all of us for doing what you do every day. It's definitely heart-centered work.
Yes. Well, thank you for having me. I appreciate you being allowed to tell my story.
Absolutely. So you all, Kendra, thank you for being on. Thank you for our listeners for being on, for hearing this very important message, and to maybe understand it differently than maybe what you thought about it before, because that's, I think, what conversation is. It's about to understand someone else's perspective on things and their day-to-day life. And that's one of the reasons why I do the Dental Handoff, because to create understanding among different folks and what their challenges are, how we can help that maybe you didn't know, or be inspired by someone else's story to say, I never thought of that. How cool would that be?
Yeah.
So for all the listeners, you know that I thank you again for all that you do every day for the public you serve. And if you wouldn't mind, go over to Apple Podcast and give a 5-star rating, because Apple's the one that matters. And then go on over to YouTube, like, subscribe, and share to your friends. We will see you soon. Again, thank you. And Kendra, I will see you soon. Take care.
Bye.